Acute pharyngitis is a uniquely miserable experience. Every time you swallow, it feels like sliding broken glass down your throat. The pain makes it incredibly difficult to eat, stay hydrated, or focus on a normal day. When the pain gets that severe, you do what millions of adults do every year. You book a doctor's appointment. And the goal for that visit is usually simple: get an antibiotic prescription and make the pain stop. Curious, but there is a fascinating disconnect happening in the exam room. When surveyed, over 80% of patients report that what they actually want from the doctor is advice on pain relief and reassurance about their symptoms. They push for an antibiotic because they mistakenly assume it's the most effective tool to get that relief. Here is the first medical reality. The vast majority of adult sore throats are caused by a virus. Antibiotics are designed specifically to kill bacteria, making them biologically useless against a viral infection. As you can see in this clinical summary from UpToDate, even when a patient has a documented bacterial infection like strep throat, antibiotics contribute almost nothing to the actual speed of symptom improvement. They are critical for preventing complications, but they don't immediately numb the pain. Because antibiotics are not a pain relief tool, the medically sound strategy for a sore throat requires a shift in focus. The true goal is targeted symptom management to keep you comfortable while your immune system clears the infection. The foundation of that symptom management protocol relies on systemic oral analgesics, medications like NSAIDs and acetaminophen. These are your heavy hitters. You swallow a pill, and it acts on your entire body to lower inflammation and block pain receptors from the inside out. Looking at this chart, ibuprofen provides a significantly higher percentage of pain reduction compared to acetaminophen at 2 to 4 hours. Tracking a 6-hour timeline reveals their profile. Relief takes 1 to 2 hours to kick in, but once it peaks, it plateaus, offering a long duration. However, ibuprofen isn't for everyone. If you have a history of gastrointestinal reflux, high blood pressure, or kidney dysfunction, you should avoid NSAIDs. Taking them can aggravate those underlying comorbidities. This clinical safety table highlights why acetaminophen is the definitive alternative. It is highly recommended for patients with those specific medical conditions, and it is the fever reducer of choice for pregnant patients, successfully avoiding the fetal risks associated with NSAIDs. You might be wondering why doctors don't just prescribe a heavy dose of systemic steroids, known as glucocorticoids, to aggressively shut down the swelling. The answer comes down to math. Steroids might shorten your throat pain by about half a day, but they carry a high risk of serious side effects like sudden mood changes and severe blood sugar spikes. For a routine sore throat, the risk vastly outweighs the reward. Systemic oral medications are the critical foundation of the relief protocol because they provide steady, reliable background defense, but they still leave that initial 2-hour gap in immediate comfort. This presents a logistical problem. If you have to wait 2 hours for a pill to kick in, how are you supposed to swallow a glass of water right now? That's where topical therapies come into play. Lozenges and throat sprays act as the rapid responders of the protocol. When you're looking at over-the-counter options, check the active ingredients on the back of the package. You want to see menthol for a strong cooling effect, or compounds like benzocaine and diclonine, which act as local anesthetics to actively numb the tissue. The trade-off with these topical treatments is strictly mechanical. They work instantly by depositing high concentrations of medicine directly onto the inflamed area. But because they sit directly on the surface, your saliva quickly washes them away, requiring you to redose frequently. You can multiply the effectiveness of these treatments with a few basic environmental adjustments. Running a humidifier stops dry indoor air from acting like sandpaper on your throat, and strictly avoiding tobacco smoke removes a major chemical irritant. Finally, adjust the temperature and texture of what you consume. Sucking on ice chips or popsicles physically numbs the tissue. You can also introduce demulcents, substances like honey or pectin, which form a soothing, protective film right over your raw mucous membranes. These outside-in methods are the perfect tactical supplement to your systemic pills, filling the timing gaps and creating a comprehensive shield against the pain. The ultimate symptom release strategy is stacking your treatments. You take an oral systemic pill to establish a baseline of relief, and then you layer topical sprays, lozenges, and hot teas on top of it to handle any sudden spikes in breakthrough pain. Stacking treatments carries a high risk of accidental double dosing. A standard acetaminophen pill safely fills a portion of your daily limit, But add a multi-symptom cold syrup containing hidden acetaminophen, and you violently overflow your safe threshold, risking severe liver damage. Always read labels meticulously. Acute pharyngitis is painful, but it is almost always a self-limiting illness. By shifting your energy away from seeking unnecessary antibiotics and instead building a smart, safe symptom management protocol, you are fully empowered to take control of your comfort while your body naturally heals.